Good morning. As the new year approaches, it's a natural time to reflect and think about what lies ahead. And for us who've been fighting the good fight since COVID-19 was first confirmed here in March of 2020, the answer to what lies ahead is a lot of uncertainty. As was widely reported last week, the county is no longer under a mask mandate. The court ruling 130 miles away that could gut public health and take away health care for our most vulnerable was not appealed by the Attorney General, which comes as no surprise. He and his campaign for higher office are using the health of all of us in the game of who can be the most irresponsible to ensure the most headlines. So here's a headline for you. Those spreading misinformation and bullying our children and parents are a menace to society. By not taking COVID-19 seriously and selling what amounts to carnival quackery, this pandemic rages on. Another variant is spreading. Vaccine acceptance is lower than it needs to be. Hospitals here and across the country are sounding the alarm. The council's failure to pass a mask mandate is disappointing and irresponsible. I hear from so many of our residents who ask what the issue is with the council, especially members who have seen the pandemic hit their districts particularly hard. I would say ask them directly. Have them explain their actions. They could adopt the health order, they could introduce a bill and pass a bill, and they could help keep our residents safe, but that's not the priority. It's baffling and that's dangerous. Across the country, researchers are closely monitoring the long-term effects of COVID-19. Medical researchers refer to those with persistent symptoms as patients experiencing post-acute COVID syndrome. But it's become better known as simply long COVID, referring to the lingering effects of the virus that can last several months after the virus is no longer present. This emerging chronic disease, which researchers believe affects about a third of those who have had COVID, is creating new challenges in the medical system, where there's currently no established diagnostic or treatment plan. There has only been a diagnostic code for long COVID since October 1st, so pulling together exact numbers locally is just now underway. The National Institutes of Health is spending $1 billion to study this new syndrome. Chronic fatigue, memory loss, chest pain, sharp spikes in blood pressure, anxiety and depression, and the loss of taste and smell. These are some of the long COVID symptoms, and the symptoms can ebb and flow, vexing doctors and frustrating patients. Some patients are in such pain they cannot work, which creates more anxiety during a pandemic. And I bring this up as a reminder that COVID can be chronic, debilitating, and prevent people from doing simple tasks. The Omicron variant has caused a jump in COVID cases. In St. Louis County, we're averaging 336 new cases per day, and early indicators are the variant is milder than previous versions of the virus. However, medical experts are not yet ready to say that with confidence. The variant was just discovered last month. I will say this again, like I've said since vaccines became available. A COVID-19 shot is your best shot at staying healthy during the holidays. Wherever you get your flu shot, ask for the COVID shot as well. They can be taken together. And yes, wear a mask. They work. There's no law against wearing one. It's your right to take care of yourself and those you love. It's your right to be responsible during a pandemic, and it's your right to do the right thing. Thank you, and I'd be happy to take any questions.
Do you want the county council to pass a mask mandate?
I believe the county council should adopt the public health order that was presented to them last week, and that's a very simple thing to do. If they prefer to pass an ordinance, they can certainly do that. That's a longer process, but it's not necessary. But I would invite them to take the pathway they choose to become engaged in this process. The lack of action by the county has made it very difficult for the school districts and left them in a battle with the Attorney General, which is unfortunate.
Why does it put school districts in that position when school districts are responsible for adopting their own?
School districts can have their own mask mandates. They have the authority to have their own mask mandates. It's much easier for them when the county sends a clear signal.
why you all decided on Thursday's decision and not to carry it out until at least the 22nd when that ruling officially kicked in?
The question is why we made the decision last week to enter the motions we did to take down the mask order. And that was based on our legal guidance and based on the ruling in Cole County Court. And until that ruling is appealed, everyone in the state is in a very difficult position.
Do you think the public still supports mask mandates, and if so, why?
The question is, do I think the public supports mask mandates? I think as cases increase, it's becoming more clear that a mask mandate is right at this point in time. That's what the CDC has recommended. That's what our pandemic task force has certainly recommended, that we continue to wear masks, and that's the recommendation of our public health officials. These public health guidelines are very difficult. It is a tug of war between what keeps the virus at bay in our community and individual rights. And it's a classic question of public health debate. We believe that masks are relatively straightforward, relatively simple, and a mild inconvenience in the presence of increasing case numbers in our community. And we believe it's much easier for folks to wear masks than some of the other more significant restrictions that we faced earlier in this pandemic. We are close to the end of this. We need to keep the case numbers beat back, and the best way to do that, to keep our kids in in-person school and to keep our family members healthy, to protect businesses, employees, and their patrons, is to keep masks on, folks, for a few more weeks.
How are you feeling about all of this? I mean, I've stood here in these meetings for months now, watching you go to bat for a mask, and how are you feeling about your colleagues, about leaders in the state, and this mandate now being no more?
So I think the question is, how do I feel about the state of COVID and about our need for public health recommendations and orders such as masks? I believe it's the right thing to do. I believe that we're in a better place when we follow the advice of our scientists, of our public health officials, of the pandemic task force, and our national leaders who are watching this pandemic very closely. I will follow those recommendations and make those recommendations and support our public health officials until we get to the other side of this. There are many issues that challenge us in St. Louis County. This is the one that's certainly the most pressing, and we continue to work on all the complex policy questions, and we'll continue to do that. My job as county executive is to protect the health and welfare of everyone in our community, and I will continue to do that.
Are you disappointed with the results?
Am I disappointed with the results of the pandemic?
The Thursday ruling.
I'm disappointed with the Cole County judge that wiped out public health orders in Missouri, the basic public health functions such as quarantines and isolation of those who are infected, of our ability to issue public health orders and protect the community. I believe that was a bad ruling, and I hope that we can find a path to appeal it, because I don't think it will be upheld. That order has initiated a lot of chaos in our state across the board, especially for our public schools.
And you mentioned the Omicron variant. Does St. Louis County have, health department have the ability to sequence and know if somebody has the Omicron variant, or do you work with the state to decide or to figure that out?
So the question is, how do we know and how do we track the Omicron variant in our region? And we track that with the support of the state. We don't sequence the Omicron variant we don't do any gene sequencing in our public health department.
Have they said, I know that there was a case in St. Louis City, have they informed you that there's a case in St. Louis County yet?
I haven't heard of any more cases besides the initial one in the city of St. Louis. Understanding how quickly this spreads, knowing what we know from the rest of the world, we know it's here. We haven't isolated yet or found it yet, but we expect that any day we'll know.
I've asked you at the last couple meetings about the appeal situation with the Cole County ruling and how it puts the county in a bad position, because I don't know if they can intervene in the case when the Attorney General is not appealing. And admit this is a convoluted question, so bear with me for a second. Wouldn't the backdoor way of appealing to just keep the mask mandate in place, have the Attorney General sue St. Louis County and then work through the process? Like, wouldn't that be a way to, in a backdoor way, appeal the Cole County ruling?
So I believe the question is the best pathway to appeal the Cole County ruling, and you suggested one. I think I'll wait until our attorneys come up with a strategy, and I'll follow their advice.
Any other questions?
Okay, thank you.